My name is Dan Austin. I'm the Nurse Clinical Coordinator of the High Desert Heart Institute, and I'm here today with Lori, one of our patients. I'm also the Clinical Director of the Pulmonary Hypertension Clinic, and Lori has been one of our patients now for approximately 1 year. Lori is a patient who has quite a unique disorder. It is called a Raynauds phenomenon. She has a condition that is a connective tissue disorder. It's a progressive disease, and when I first met her a year ago, she wasn't the smiling, happy face that you see her today. She has rheumatoid arthritis also in her history. She has vasculitis with a severe tissue necrosis that you do not see today, but was in effect present a year ago when we first met. And so I've asked Lori to come here today to really talk about a little bit about her history. She's been very gracious and kind because what we've been doing here at the High Desert Heart Institute is been doing some different integrative processes where we take not only conventional medication to treat these type of syndromes, but also to look at nutraceutical therapy and how it can be used in combination to benefit our patients. And again, a year ago when we first met, Lori came to me and was in severe pain. And you see her today, you see some fingers here, and when we first met, I couldn't even do this. I couldn't touch her fingers. It was amazing because Dr. Siva sent her over to the clinic, and it was amazing because he said, Dan, this is quite a phenomenon. She was doing what we call auto amputation of her fingers. She couldn't play with her iPhone. This is going to sound sort of corny, but her index finger, was actually black and blue. Black, it was actually, we call auto amputating. It was so necrotic, the condition was so severe that she had incredible amount of pain. And on the back side of her fingers, these were black and blue, before, and on the vasculitis, she had such severe tissue necrosis. Her whole facial expression, was just incredible. And so what Dr. Siva had given me orders to do was to start her out on a medication called Adcirca. It's a medication that is used for patients with a connective tissue disorder called Raynauds syndrome. Hopefully that it would be able to prevent or actually you work at what's called the nitric oxide pathway. And then at the same point in time, Dr. Siva wanted to start her on a good amount of a nutraceutical supplement called Arginine. And so we started her out on both of these products, and today, it's been 1 year later, we've been taking some serial pictures and watching how the vascular bed of her nails have just improved so much that in patients when we first met, I couldn't do any type of squeezing of her fingertips right now going through, and she's just like, now going ahead and doing and clapping her hands. I mean, these were things that she could not do anymore. And I mean, it was like, it's amazing when we see patients like this that are able to do just the simple things that we take for granted, but that she would come and see me once every month, once every 2 months to pick up some more L-arginine and to get some more Adcirca. But it was amazing to see the true changes that was happening in her vascular bed, and also also what was happening to her as a person. If you can just tell me a little bit about what you feel this has meant to you and how it's changed your life.
I feel it saved my life. When I was sent to see you guys, they were at the point of ready to cut my fingers. That was the end of it. I was going to be losing my fingers, and we were desperate of something to save my life. And when I started using the L-arginine, it's unbelievable the changes. I couldn't brush my teeth. I couldn't wash my face. I couldn't do the things like you said most people can do. I couldn't use my hands. My mother was taking care of me. That's how bad it was. I couldn't let anybody touch my hands or get close to them because it was so painful. I was miserable. I was ready to give up on life. And a year later, I am like almost back to normal. The happy person I used to be.
I remember it was interesting because when you came into the clinic, it was when you first came over to the clinic, you really were at a point where you were giving up, and it was like you weren't. I think you weren't really. You didn't really expect this to do what we were hoping it would do, and it's truly been tremendous. How I'm truly amazed. What arginine does is is converted to nitric oxide, and what it does, it has a very, very strong vasodilatation effect on this going through. But it also does is it helps improve the endothelial lining, that single layer lining, very on the microvascular stage. So it gets down into the fingertips, not just in our larger vessels, but the microvascular area right here. So this is areas like getting under the nail bit and getting down to the fingertips. This is a perfect example of how a nutraceutical supplement like this can have such a profound benefit. I really do think it has changed your life.
Oh,
I
tremendously.
Really do. you're a totally different person than you were a year ago, and I hope this continues to have the same benefit for you on in the future. So I do appreciate you taking the time to come in and coming all up the hill, and the best of luck for you in the future.
Thank you.
Thanks
for
very
saving my life.
Thank you. Thank you.